Here's our host, Tian Wei.
This is World Insight with me, Tian Wei. We begin with the spike in COVID infections. Confirmed cases worldwide are approaching 500 million with over 6 million deaths, according to latest data from Johns Hopkins University. The Chinese mainland pulls out all the stops to battle an infection spike, with a new spike in recent days, particularly with the latest number on Tuesday. Two areas in particular are struggling, the megacity of Shanghai and the northeastern province of Jilin. In Shanghai, the great majority of cases relatively benign, with most of them asymptomatic carriers. How well is the city and China dealing with the situation? Has the time come for China to focus on easing its COVID measures? What could be the end of the game for the pandemic? For deeper insights, we are joined in by panelists from different parts of the world. For more on the recent pandemic surge, we are joined in New York, Dr. Robin Moon, who's an adjunct associate professor from the City University of New York, Graduate School of Public Health and Health Policy. In San Francisco, Monica Gandhi, a professor of medicine at the University of Carolina, San Francisco. And in Nanjing, last but not least, Wu Zhiwei, director from the Center for Public Health Research of the Medical School of Nanjing University. Ladies and gentlemen, welcome to the program. The numbers are skyrocketing, as we know. A lot of countries have already eased their restrictions, mainly due to various reasons of their own choices. Now, Dr. Wu, the world's attention, of course, is on China. How do you look at the latest spike, particularly the huge number of asymptomatic cases?
Well, this is definitely a huge challenge with a big city like Shanghai with 25 million population, and we have seen that Shanghai has been steadily increasing in the confirmed cases and the asymptomatic cases as well. So I think in the next few days you will still see a dramatic increase, although the city is sealed down initially by two different parts along the Huangpu River, but still that so far we see there is no abating in the number of new cases. So this is a tremendous problem because this indicating that the unnoticed infection has been going on for quite a while. So that's why you see in many different communities there is a very serious infection as well. So this is definitely a big challenge in dealing with the spreading of the virus.
I understand. Mr. Wu, if I could just follow up, we see the asymptomatic cases increases now, even with the shift hospitals over there being built right now in Shanghai, very unlikely to accommodate all of the possible future asymptomatic cases, and therefore, how do you see the policies are likely to be adjusted according to the realities on the ground? Now, of course, it's too early to say that, but we can see when numbers increase, they increase dramatically. They increase with a mathematical way.
Well, you see, we see a huge number of asymptomatic cases. I think it's probably is a better idea you concentrate them all in this this hospital facilities, because you're basically building up a tremendous human pool, and that actually, if somebody convert into an confirmed cases, then the situation could get worse. Most of those people in Shanghai, we know that they are either no symptoms or they are very minor symptoms. So there is basically, they don't need any medical intervention. What all they need is basically you provide a certain monitoring to prevent the development into severe cases. So I think this is very critical, that we need to think in a different way, not completely getting rid of a virus. We have to understand that this virus is going to stay with us.
And now we also see different scenarios and different solutions in other countries of choices. Both of the other two guests are right now located in the United States. Professor Gandhi and Dr. Moon, tell me more about what do you make of the various choices countries take at this moment. Maybe we start with Dr. Moon first.
Yes, we as a country are looking at the data that's mostly limited to the acute care systems, the hospitals, hospitalizations, and ventilators, which is extremely important. If you remember 2 years ago in New York City, we had a very, very difficult time in the hospital systems then. But we also need to be looking at the socioeconomic, social factors, and that is not being looked at in terms of easing the restrictions and wearing masks and what we do with our school children and so on. It feels to me it's a little too early to really repeal all of the mask wearing policy. That is a small price to pay, compared to all other difficulties we have experienced so far. And now there is an argument, which is a valid argument, for school children, young school children, to have not be able to see the mouth, movement in speeches and speech and cognitive development. But I think making a blanket policy to repeal all of the mask wearing across the country is a mistake at this point.
I see. So you have your own debate within the country and your city as well. The other state, of course, California, has been heavily hit also years ago by the pandemic. The situation has been evolving. What about the latest from you, Professor Gandhi? You're based in San Francisco.
Well, yes, I agree that the United States has really started to focus on severe disease and preventing severe disease. So the focus now, even in any non-pharmaceutical intervention, including mask wearing, is on hospitalizations. We are at our lowest point of hospitalization since spring of 2020. And actually most countries have taken a different approach than COVID zero, which unfortunately is impossible to obtain. It isn't because of human behavior. It actually has to do with the virus behavior, that it's extremely difficult to get a virus out of the country when it's contained in animals. There's animal reservoirs. It's a long infectious period. It looks like other respiratory pathogens, and our vaccines are not sterilizing. And so unfortunately, those are the 4 reasons why we can't eradicate COVID. Right. And so the rest of the world has sort of moved towards focusing on preventing severe disease with vaccines, and then therapeutics for those who are immunocompromised or declined to take the vaccine.
Now, Dr. Wu, since we talk about the vaccine, this is very crucial. Many of the asymptomatic cases that you have observed, both in Shanghai and Jilin also, are those who have already got the vaccines. In China, the vaccine rate is also relatively high, except among senior populations. It's very tough because some of them have some basic diseases that's very hard for them to be inoculated. So tell me more, Dr. Wu, about your confidence of vaccines at this point. Now, there's already talk about the 3rd and even the 4th inoculation of vaccines in China. What do you make of the prospect while the country is also, struggling with this current situation while maintaining still dynamic COVID policy?
Well, the vaccine, we know that it definitely would provide certain protections, but it's not sterilizing, as Dr. Gandhi just mentioned. We all understood that, and as the vaccination, people who are vaccinated, actually, when the time goes by, the vaccine's efficacy will go down. Right. But from the clinical, we have seen that the people who receive the vaccine, they fare much better than those who do not receive the vaccine. So basically, vaccine is effective in reducing the severe cases. So from this point, that I think the booster shots would help people to build up or strengthen their immunity, provide a better protection for the people who actually getting infected. So I think in this sense, the vaccine is still effective in terms of reducing the severe cases. So I would encouraging people who actually received two doses of the vaccines would receive the third one. And for those senior elderly people who have not received vaccine, I think it's very critical for them to receive the vaccine for whatever reason, if it's possible. We have seen in Hong Kong's situation that one of the key reasons why elderly people have suffering such a high death rate is that many of the people did not receive the vaccine or did not receive the complete vaccination.
Yeah, the rate of vaccination in Hong Kong is very low compared to many other countries and regions, 20 to 30%. So that's very low at this point. We look at, since you talk about Hong Kong, if I could just ask you a little bit further about Hong Kong. Now we see its restrictions are being eased to a certain extent. Now, it is still trying to uphold the earlier policy, but ease to a certain extent in Hong Kong. How, as a metropolitan city, as a global metropolitan city, is it likely to be an important case study also for China as a whole?
Well, Hong Kong is quite a special place because
sure, it's one country, two systems. It's governed differently.
Yeah. It's a very important international goods transportation hub and also for human transportation as well. So Hong Kong's COVID-19 prevention policy was basically between the mainland China and the Western countries. So it cannot completely sealed off or cannot completely locked down because there are 7 million people who heavily depend on Hong Kong's economic and commercial activities. So since last year, and now we think that Hong Kong basically removed some of the restrictions. The situation is not getting worse. So that actually indicates to us that we do have a certain leeway in terms of designing a new, more flexible policy based on the new infection cases.
All right.
By paying attention to the highly vulnerable population and allow the younger population who will receive the vaccines to have a normal economic or social activities.
Right. We only have about less than 3 minutes left, but this is a very important question. Since a lot of countries already eased the restrictions on prevention and control, how worried are we about a new variant that might be more spreading even more than Omicron? Of course, all of these are scenarios. There are many scenarios we could look at. We understand that there are new variants already being studied. We do not know how fast it will spread, how serious it will become once it's really fast spreading among the population. Dr. Moon.
Yeah, we don't have the evidence yet how dangerous this virus subvariant will be. There's XE and XF as well. But I will say two things. One, as long as we have the inequitable vaccine distribution in the world, in the globe, this evolvement of the virus will continue. So right now we have the entire continent of Africa and some other low-income countries under 15% of vaccination, and that's going to continue to provide the breeding ground for the virus to continue to ecologically release. That's one. And the other is locking down and really having severe restriction has its severe downside of economic cost, and those in the society with the socioeconomic inferior socioeconomic level will be getting the brunt of it. So in terms of taking care of and making the treatment and then care and the prevention equitable, while we all continue to have the prevention protection and safety measures is critical.
All right. Professor Gandhi, also, what do you think about the scenarios of new variants and how likely they to be at this point?
The WHO released a plan just a week ago about how to deal with new variants moving forward. They said that we have the baseline scenario right now where vulnerable people will need boosters. The best case scenario is we have a less virulent variant, in which case immunity will be created without boosters. And the worst case scenario is that we get a more virulent variant, in which case the entire planet, speaking to Dr. Moon's point, will need boosters. The entire planet will. So we have ways to work on variants, even if a worst one comes along, because so far the vaccines have all worked against any variant that's come about, because they create adaptive immunity, and we're able to use our current vaccines.
We are running out of time, and sorry I would not have time for Dr. Wu to respond for now, but thank you so much for the three of you for joining us. Robin Moon, Monica Gandhi, Wu Zhiwei, really appreciate it. Thank you so much. All the best.